What are rare lung diseases? Rare lung diseases are uncommon conditions that affect the respiratory system. Due to their rarity, these diseases may be less well known and often pose diagnostic and therapeutic challenges. Here are some examples of rare lung diseases. 1. Lymphangioliomyomatosis, LAM. LAM is a rare lung disease characterized by the proliferation of smooth muscle cells, leading to the formation of cysts in the lungs. It primarily affects women of childbearing age. Symptoms include shortness of breath, pneumothorax, collapsed lung, and cough. 2. Pulmonary alveolar proteinosis, PAP. PAP is a rare disorder where waxy, granular material accumulates in the alveoli, interfering with normal gas exchange. Symptoms include progressive dyspnea, cough, and fatigue. 3. Pulmonary Langerhans cell histiocytosis, PLCH. PLCH is characterized by the accumulation of Langerhans cells in the lung tissue, leading to inflammation and damage. Common symptoms include cough, chest pain, and shortness of breath. 4. Pulmonary veno-occlusive disease, PVOD. VOD is a rare form of pulmonary hypertension characterized by the blockage of small veins in the lungs, leading to increased pulmonary artery pressure. Symptoms include shortness of breath, chest pain, and fatigue. 5. Diffuse panbronchiolitis, DPB. DPB is a chronic inflammatory lung disease that primarily affects the small airways, bronchioles. It is more prevalent in East Asian populations and is characterized by chronic cough and recurrent respiratory infections. 6. Pulmonary capillary hemangiomatosis, PCH. PCH is a rare condition where the capillaries in the lungs proliferate, leading to increased blood flow and pulmonary hypertension. Symptoms include shortness of breath and fatigue. 7. Eosinophilic granulomatosis with polyangiitis, EGPA. EGPA, formerly known as Churg-Strauss syndrome, is a rare form of vasculitis that can affect the lungs among other organs. It is characterized by asthma, eosinophilia, and systemic vasculitis. 8. Alpha-1 antitrypsin deficiency, AATD. AATD is a genetic disorder that can lead to lung and liver disease. It results from a deficiency of alpha-1 antitrypsin, a protein that protects the lungs from damage. Symptoms include chronic obstructive pulmonary disease, COPD, at an early age. 9. Pulmonary hypoplasia. Pulmonary hypoplasia is a rare condition where the lungs do not develop to their normal size, leading to respiratory insufficiency. It may occur in association with congenital diaphragmatic hernia or other developmental abnormalities. 10. Primary ciliary dyskinesia, PCD. PCD is a rare genetic disorder affecting the cilia in the respiratory tract, leading to impaired mucociliary clearance and recurrent respiratory infections. Symptoms include chronic sinusitis, bronchiectasis, and infertility. Due to their rarity, these diseases often require specialized care and expertise for accurate diagnosis and management. Research and collaboration among healthcare professionals and researchers are essential to advance our understanding of these conditions and improve treatment options. What is the prevalence of the rare lung diseases? The prevalence of rare lung diseases varies significantly, and each condition has its own level of rarity. Generally, rare diseases are defined as those affecting fewer than 200,000 people in the United States, according to the Rare Diseases Act of 2002. However, the prevalence can differ by region and population. Here are some examples of the prevalence of specific rare lung diseases. Lymphangioliomyomatosis, LAM. LAM is considered a rare disease, and it predominantly affects women of childbearing age. The estimated prevalence is around 3 to 5 cases per million females. Pulmonary alveolar proteinosis, PAP. PAP is also considered rare, with an estimated prevalence of 3 to 6 cases per million individuals. It can occur in both adults and children. Pulmonary Langerhans cell histiocytosis, PLCH. PLCH is a rare disease that primarily affects young to middle-aged adults. The prevalence is estimated to be around 1 to 2 cases per million individuals. Pulmonary veno-occlusive disease, PVOD. VOD is a rare form of pulmonary hypertension, and its prevalence is not well established. It is considered a subset of pulmonary arterial hypertension, PAH, which itself is a rare condition. Diffuse panbronchiolitis, DPB. DPB is more prevalent in East Asian populations, particularly in Japan. The incidence in these populations is higher than in other parts of the world. Pulmonary capillary hemangiomatosis, PCH. PCH is extremely rare, with only a limited number of cases reported in the medical literature. It is considered a subset of pulmonary veno-occlusive disease, PVOD. Eosinophilic granulomatosis with polyangiitis, EGPA. EGPA is a rare form of vasculitis. While the prevalence is low, it is higher than some other forms of vasculitis, such as granulomatosis with polyangiitis, GPA. Alpha-1 antitrypsin deficiency, AATD. AATD is one of the more common rare lung diseases. It is estimated to affect about 1 in 2,500 to 1 in 5,000 individuals. However, it remains underdiagnosed in many cases. Pulmonary hypoplasia. Pulmonary hypoplasia is relatively rare and often occurs in association with other congenital conditions. The prevalence may vary depending on the underlying cause. Primary ciliary dyskinesia, PCD. PCD is considered rare, with an estimated prevalence of 1 in 10,000 to 1 in 20,000 live births. It is a genetic disorder that affects ciliary function in various organs, including the respiratory tract. It's important to note that the rarity of these conditions can pose challenges in terms of diagnosis, access to specialized care, and research efforts. Collaborative efforts among healthcare professionals, researchers, and patient advocacy groups are crucial in advancing our understanding of these diseases and improving outcomes for affected individuals. Who might get rare respiratory diseases? Rare respiratory diseases can affect individuals of any age, gender, or background. And their occurrence is often influenced by a combination of genetic, environmental, and sometimes unknown factors. Here are some factors that may contribute to the development of rare respiratory diseases. 1. Genetic factors. Many rare respiratory diseases have a genetic component. Individuals with specific genetic mutations or variations may be at an increased risk of developing certain rare lung conditions. Examples include alpha-1 antitrypsin deficiency, AATD, primary ciliary dyskinesia, PCD, and hereditary hemorrhagic telangiectasia, HHT. 2. Environmental exposures. Some rare lung diseases are associated with exposure to certain environmental factors or toxins. For instance, exposure to asbestos can lead to pleural mesothelioma, while exposure to silica dust can contribute to certain forms of pneumoconiosis. 3. Occupational exposures. Certain occupational exposures, such as those found in specific workplaces or industries, may increase the risk of developing rare respiratory diseases. Workers in occupations with exposure to hazardous substances like coal dust, metal dust, or toxic gases may be at risk. 4. Infections. Infections, whether viral, bacterial, or fungal, can contribute to the development of rare lung diseases. Conditions such as chronic infections or certain granulomatous diseases may result from specific infectious agents. 5. Autoimmune factors. Some rare respiratory diseases are autoimmune in nature, meaning the immune system mistakenly attacks the body's own tissues. Conditions like sarcoidosis or eosinophilic granulomatosis with polyangiitis, EGPA, fall into this category. 6. Congenital and developmental factors. Certain rare respiratory diseases, such as congenital pulmonary malformations or developmental disorders affecting lung growth, may be present from birth or develop during early childhood. 7. Rare genetic syndromes. Some rare respiratory diseases are part of broader genetic syndromes that affect multiple organ systems. These syndromes may involve abnormalities in lung development, function, or structure. 8. Unknown causes. In some cases, the exact cause of a rare respiratory disease remains unknown. Research is ongoing to understand the underlying mechanisms and risk factors associated with these conditions. It's important to note that while these factors may contribute to the development of rare respiratory diseases, not everyone with these risk factors will necessarily develop a rare lung condition. Additionally, some rare respiratory diseases may occur sporadically without a clear familial or environmental association. Because rare respiratory diseases are diverse and can result from various factors, a comprehensive medical evaluation, including genetic testing and specialized diagnostic procedures, is often necessary for accurate diagnosis and appropriate management. If there is a suspicion of a rare lung disease, consultation with specialists in pulmonology, genetics, or other relevant fields may be beneficial. Why rare lung diseases are often called orphan lung diseases. The term orphan lung diseases refers to rare lung diseases that are characterized by their low prevalence and the limited attention they receive in terms of research, diagnosis, and treatment. The use of the term orphan in this context is borrowed from the broader concept of orphan diseases or rare diseases, which are conditions that affect a relatively small number of people in the population. Here are some reasons why rare lung diseases are often called orphan lung diseases. 1. Low prevalence. Orphan lung diseases are rare by definition, affecting a small number of individuals within the population. The low prevalence makes these conditions less visible in healthcare settings and less likely to attract widespread attention. 2. Limited research and understanding. Due to their rarity, there is often limited research conducted on orphan lung diseases compared to more common respiratory conditions. This lack of research can result in a limited understanding of the underlying causes, mechanisms, and optimal treatment strategies. 3. Challenges in diagnosis. Rare lung diseases may present with atypical symptoms, and healthcare professionals may not be familiar with these conditions. This can lead to challenges in accurate and timely diagnosis, further contributing to the orphan status of these diseases. 4. Limited treatment options. The scarcity of research and understanding often translates into a lack of approved or standardized treatment options for many orphan lung diseases. Patients with these conditions may face challenges in accessing effective therapies. 5. Limited pharmaceutical interest. Pharmaceutical companies may be less inclined to invest in the development of treatments for rare diseases due to the small patient populations. This can result in a lack of financial incentives for drug development. 6. Fragmented patient communities. Individuals with rare lung diseases may be scattered across different geographic locations, making it challenging for them to form cohesive patient communities. This fragmentation can hinder advocacy efforts and awareness campaigns. 7. Lack of expertise. Healthcare professionals, including pulmonologists and other specialists, may have limited experience and expertise in diagnosing and managing rare lung diseases. This can contribute to delays in diagnosis and appropriate care. Efforts are being made by patient advocacy groups, researchers, and healthcare professionals to raise awareness, promote research, and improve the diagnosis and management of rare lung diseases. Collaborative initiatives, increased funding, and greater international cooperation are essential to address the unique challenges associated with these conditions and improve outcomes for affected individuals. What causes rare lung diseases? Rare lung diseases have diverse and often complex causes. These conditions may result from a combination of genetic, environmental, infectious, immunological, or developmental factors. It's important to note that the specific causes vary widely among different rare lung diseases. Here are some general categories of factors that may contribute to the development of rare lung diseases. 1. Genetic factors. In some cases, rare lung diseases are caused by genetic mutations or variations. These genetic factors may affect the structure or function of proteins involved in lung development, immunity, or other critical processes. Examples include alpha-1 antitrypsin deficiency, AATD, primary ciliary dyskinesia, PCD, and hereditary hemorrhagic telangiectasia, HHT. 2. Environmental exposures. Exposure to certain environmental substances or toxins can contribute to the development of rare lung diseases. For instance, exposure to asbestos is a known risk factor for pleural mesothelioma, and exposure to silica dust can lead to pneumoconiosis. 3. Occupational exposures. Certain rare lung diseases may be associated with specific occupational exposures. Workers in certain industries, such as mining, agriculture, or construction, may face increased risks due to exposure to hazardous materials or pollutants. 4. Infections. Infections, whether viral, bacterial, or fungal, can trigger or contribute to the development of rare lung diseases. Chronic infections or certain granulomatous diseases may result from specific infectious agents. 5. Autoimmune factors. Some rare lung diseases have autoimmune components, where the immune system mistakenly attacks the body's own tissues. Conditions like sarcoidosis, eosinophilic granulomatosis with polyangiitis, EGPA, and rheumatoid lung disease fall into this category. 6. Congenital and developmental factors. Certain rare lung diseases may result from congenital or developmental abnormalities. These conditions may affect lung development, structure, or function and may be present from birth or develop during early childhood. 7. Unknown causes. In some cases, the exact cause of a rare lung disease remains unknown. Research is ongoing to understand the underlying mechanisms and risk factors associated with these conditions. 8. Rare genetic syndromes. Some rare lung diseases are part of broader genetic syndromes that affect multiple organ systems. These syndromes may involve abnormalities in lung development, function, or structure. It's important to emphasize that rare lung diseases are a heterogeneous group, and each condition has its unique set of causes and risk factors. Due to their rarity, these diseases often require thorough evaluation by healthcare professionals with expertise in pulmonary medicine, genetics, or other relevant specialties. Research efforts are ongoing to unravel the underlying causes of rare lung diseases and improve diagnostic and treatment options for affected individuals. What are the symptoms of rare pulmonary disease? Symptoms of rare pulmonary diseases can vary widely depending on the specific condition. While each rare lung disease has its unique set of symptoms, there are some general respiratory symptoms that may be present in individuals with these conditions. It's important to note that the severity and combination of symptoms can differ from person to person. Here are some common respiratory symptoms associated with rare pulmonary diseases. 1. Shortness of breath, dyspnea. Many individuals with rare pulmonary diseases experience difficulty breathing or shortness of breath. This symptom can range from mild to severe and may be progressive. 2. Cough. Chronic or persistent cough is a common symptom in various rare lung diseases. The character of the cough, such as its frequency and whether it is productive, producing sputum, can vary. 3. Chest pain. Chest pain may occur in some rare pulmonary diseases, especially those associated with inflammation of the lung tissue or the pleura. The pain may be sharp or dull and can worsen with breathing or coughing. 4. Wheezing. Wheezing is a high-pitched whistling sound produced during breathing and may be present in conditions that cause airway constriction or narrowing. 5. Fatigue. Fatigue is a common nonspecific symptom in many respiratory conditions, including rare pulmonary diseases. It can result from the increased effort required for breathing and the impact of the disease on overall health. 6. Recurrent respiratory infections. Some rare lung diseases may lead to recurrent respiratory infections, as the normal lung defense mechanisms may be compromised. These infections can contribute to worsening symptoms. 7. Hemoptysis. Hemoptysis refers to the coughing up of blood or blood-stained sputum. It can occur in certain rare pulmonary diseases, particularly those affecting the blood vessels or lung tissue. 8. Clubbing of fingers and toes. Clubbing is the enlargement and rounding of the fingertips and toes. It can be associated with certain lung diseases, indicating chronic hypoxia. 9. Unexplained weight loss. Weight loss without an apparent cause may occur in some rare pulmonary diseases, reflecting the overall impact of the condition on the individual's health. 10. Cyanosis. Cyanosis is a bluish discoloration of the skin and mucous membranes, resulting from inadequate oxygenation. It may be observed in severe cases of respiratory failure. It's crucial to recognize that these symptoms are not exclusive to rare pulmonary diseases, and they can occur in more common respiratory conditions as well. Due to the diverse nature of rare lung diseases, an accurate diagnosis often requires a comprehensive evaluation by healthcare professionals, including pulmonologists, geneticists, and other specialists. If an individual is experiencing respiratory symptoms, seeking prompt medical attention is essential for proper diagnosis and management. Components of the lungs affected. Rare pulmonary diseases can affect various parts of the lungs, including the airways, air sacs, alveoli, blood vessels, pleura, and surrounding structures. The specific area impacted often determines the nature of the disease and the resulting symptoms. Here's a breakdown of how different rare pulmonary diseases can affect different components of the lungs. 1. Airways. Diseases that primarily affect the airways may result in inflammation, narrowing, or obstruction of the bronchial tubes. This can lead to symptoms such as cough, wheezing, and shortness of breath. Examples include diffuse panbronchiolitis, DPB, affects the small airways, bronchioles. Primary ciliary dyskinesia, PCD, a genetic disorder affecting the cilia in the airways. 2. Air sac, alveoli, and lung tissue. Conditions affecting the air sacs or lung tissue may result in damage, scarring, or abnormal cell growth within the alveoli. This can impact gas exchange and lead to symptoms such as shortness of breath and reduced lung function. Examples include lymphangioleiomyomatosis, LAM, forms cysts in the lung tissue. Pulmonary alveolar proteinosis, PAP, accumulation of a waxy material in the alveoli. Pulmonary Langerhans cell histiocytosis, PLCH, accumulation of Langerhans cells in the lung tissue. Interstitial lung disease, ILD, encompasses various disorders affecting the lung interstitium, includes alveolar walls. 3. Blood vessels. Diseases affecting the blood vessels in the lungs can lead to increased pressure, reduced blood flow, and impaired oxygenation. These conditions are often classified under pulmonary vascular diseases. Pulmonary hypertension, increased blood pressure in the pulmonary arteries. Chronic thromboembolic pulmonary hypertension, TEPH, chronic blood clots in the pulmonary arteries. Pulmonary veno-occlusive disease, PVOD, blockage of small veins in the lungs. 4. Pleura. Diseases affecting the pleura involve inflammation, fluid accumulation, or other abnormalities in the double-layered membrane surrounding the lungs. Examples include pleurisy, pleuritis, inflammation of the pleura. Pleural effusion, accumulation of excess fluid in the pleural space. Mesothelioma, cancer affecting the pleura. 5. Chest wall. Some rare pulmonary diseases impact the chest wall structures, leading to restrictive lung patterns. Examples include kyphoscoliosis, deformity of the spine affecting chest wall movement. Pectus excavatum and pectus carinatum, congenital deformities affecting the chest wall. 6. Rare genetic syndromes. Certain rare lung diseases are part of broader genetic syndromes that may affect multiple lung components. Examples include alpha-1 antitrypsin deficiency, AATD, genetic disorder affecting lung and liver tissues. Cystic fibrosis, genetic disorder impacting the airways and other organs. 7. Blood and lymphatic vessels. Conditions affecting the blood and lymphatic vessels can lead to abnormal fluid accumulation, bleeding, or compromised lymphatic drainage. Examples: chylothorax, accumulation of chyle in the pleural space, lymphangioleiomyomatosis, LAM. 8. Nerves and muscles. Neuromuscular disorders can affect the nerves and muscles involved in breathing, leading to respiratory muscle weakness and respiratory insufficiency. Examples: myasthenia gravis, muscular dystrophy, Amyotrophic lateral sclerosis, ALS. 9. Genetic factors. Certain rare lung diseases have a genetic basis and may involve mutations that affect various aspects of lung function, structure, or immune response. Examples: alpha-1 antitrypsin deficiency, AATD, primary ciliary dyskinesia, PCD. 10. Developmental abnormalities. Some rare pulmonary diseases result from congenital or developmental abnormalities, impacting lung growth, structure, or function. Examples: pulmonary hypoplasia, congenital pulmonary malformations. These examples illustrate the diversity of rare pulmonary diseases and the various ways they can affect different components of the respiratory system. Due to the complexity of these conditions, a thorough evaluation by healthcare professionals with expertise in pulmonary medicine, genetics, or other relevant specialties is often necessary for accurate diagnosis and management.